The findings of this study are alarming and reveal a dangerous gap in public awareness regarding sexually transmitted infections, STIs. Despite decades of education and prevention efforts, many people continue to underestimate their own risk of infection. This misconception has real consequences as it directly influences behavior. Many individuals forego protective measures based on the false assumption that they and their partners are healthy. This is a serious misjudgment, as some STIs, like chlamydia, can be completely asymptomatic while still causing long-term damage, including infertility. The study underscores the urgent need to break the silence, confront taboos, and reinforce public health strategies before more people suffer preventable health consequences. One of the most concerning findings is the inconsistency in condom use. While most sexually active people have used condoms at some point, only half of those who are not in committed relationships report using them regularly. This means a significant portion of sexually active individuals are engaging in unprotected sex, increasing their risk of contracting infections without even realizing it. The most common reason given for not using condoms, believing that both partners are healthy, is not just misguided but dangerously naive. Many STIs, including chlamydia, gonorrhea, and human papillomavirus, HPV, often present no symptoms in the early stages, allowing them to spread unnoticed. Without regular testing, there is no way to be certain of one's STI status, and by the time symptoms appear, complications may have already developed. Even more troubling is the widespread lack of communication about sexual health. The study found that nearly 3/4 of individuals in relationships do not discuss STIs with their partners before having sex. This silence, driven by embarrassment, stigma, or a false sense of security, contributes to the continued spread of infections. Open and honest conversations about sexual health should be the norm, not the exception. Yet, social discomfort around these topics persists, leaving many people uninformed and vulnerable. The lack of awareness is particularly evident when it comes to chlamydia, one of the most common STIs, especially among young people. The fact that 40% of respondents had never even heard of chlamydia is deeply concerning. Even among women under 25, the primary target group for free screening programs, less than half were aware of this critical preventive service. This highlights a major failure in public health communication. If people do not know that free testing is available, they will not seek it out, and undiagnosed infections will continue to spread. Chlamydia is not a minor concern. If left untreated, it can cause severe complications, including pelvic inflammatory disease, chronic pain, and infertility in both men and women. That such a serious health risk remains largely unknown is a clear sign that current awareness campaigns are not reaching the people who need them most. Although public health initiatives like the Liebesabend campaign are working to spread information through digital platforms and influencers, the study suggests that these efforts have not yet had the necessary impact. Social media campaigns alone are not enough. Education must be embedded into schools, healthcare settings, and everyday conversations. The fact that so many young adults remain unaware of STIs and their risks shows that existing approaches are failing to create lasting behavioral change. The study's results paint a troubling picture. Complacency, misinformation, and stigma continue to fuel the spread of STIs, despite the availability of effective prevention and treatment options. Without significant changes in public health strategies, the situation will only worsen. It is not enough to offer free screenings. People need to be actively informed about them. It is not enough to promote condom use. Individuals must understand the real risks of unprotected sex. It is not enough to rely on personal responsibility. Structural and systemic changes are required to ensure that sexual health education is accessible, accurate, and unavoidable. If these warning signs are ignored, the consequences will be severe. STIs will continue to spread silently, leading to long-term health complications that could have been prevented. Infertility rates will rise, medical costs will increase, and the burden on the healthcare system will grow. This study is a wake-up call. Unless immediate action is taken to dismantle misinformation, normalize STI testing, and encourage open dialogue about sexual health, we will face a public health crisis that could have been avoided. The question is not whether we can do better. It is whether we will act before it is too late.